Hello, we'd like to welcome you back to the Vodcast Organizational Structures and Support for IPE. As you know, this section is built in two different modules. The first one, building IPE infrastructure, but today, Elise Pierweiler and I will be talking about Module 2, engaging interprofessional leaders and stakeholders. Through this presentation, we hope you will be able to, we hope to meet the following objectives. We hope to identify key principles for communicating with leadership to implement interprofessional education and collaborative practice in your institution, and to also identify considerations and selection of effective stakeholders and/or partners that will promote sustained engagement. There are some critical success factors for IPE-CP. Development of an effective interprofessional education and collaborative practice program, as with any other organizational change effort, cannot simply begin or end with curriculum development, implementation, and evaluation. Remember that we are changing a long-established culture of care and education. As such, a great deal of spade work must be accomplished before, during, and following the development and implementation of interprofessional experiences and/or curriculum. Many of these are at the institutional and community levels. First, it's important to commit to a culture of health. This construct has multiple meanings based on one's perspective, including how we envision health at the macro level. This would include such things as access to affordable and quality health services, in addition to accountable, data-driven policies for health and health care. Additionally, at the individual level, it's important that it may mean that each individual takes proactive responsibility for her or his own health. This should undergird the work that you hope to undertake. Of course, this cannot be done in isolation. It takes constant communication and negotiation with colleagues and leaders to create this compelling vision for where you hope to go. Once established, it is helpful to develop a case statement that describes the team's vision or roadmap for the course you hope to take. This may not be an entirely static document, but it's good to get it on the table to remind each about the vision for the future. Additionally, it is necessary to position resources for IPE-CP efforts appropriately. This is not a resource-neutral undertaking at this point in its history. Remember, we are changing a culture, and that the current culture has predetermined what are the resources and where are they being allocated. The new culture may require that some resources be shared and/or developed together. So it's important to make sure that these resources, whether they be human, space, or administrative, are approximated and established up front. For this to occur, it inevitably will be necessary to engage senior leadership. Many of us who have been involved in IPE-CP in the past attempted to do this in isolation with a few good colleagues, as it were, without thinking of implementation and sustainability at the institutional level. These grassroots efforts, at least in my own case and a few others I'm familiar with, were unfortunately unsuccessful. It has become increasingly clear over the past few years that it takes both a top-down and bottom-up approach for success. As such, in addition to senior leadership, we must build a village, as it were, in order to change the community. Just as collaborative interprofessional care cannot be accomplished by one profession, IPE-CP cannot be accomplished alone. It is necessary to partner with key stakeholders who include, at a minimum, colleagues, institutional partners, students, community agents or patient advisors, and ultimately the patients or clients themselves. As we look at recent and future changes in the emerging healthcare landscape, it is evident that these partnerships are going to become increasingly important in the coming years. All of this requires that one has good understanding of the organization and the ability to communicate effectively with key leaders, partners, and stakeholders. First, it's good to assess your situation. Whether you're building an existing IPE-CP effort or initiating one for the first time, it's important to understand your leadership structure, organizational chart, within your institution and those of other institutions if it's the case that you will be collaborating outside your own. Some important considerations include determining where IPE-CP is positioned. For example, it may not be optimal if it is positioned within a small cadre of colleagues without access to required resources. Following from this, it's important to consider if the IPECP leader is at the right level to lead such a large change effort that traverses multiple people, colleges, programs, institutions, or even communities. Do they really have the access to or the resources that they will need to make this successful? If there is an identified leader, or if you are the leader, have you identified key champions or other co-leaders? Again, I've seen many wonderful changes fail as a result of not being institutionalized, often a result of not engaging leaders, stakeholders, and partners who are able to garner resources to keep them going. All of this points to the importance of IPECP becoming institutionalized or hardwired into the organization. Just as we cannot imagine a health professions program not including anatomy in the curriculum, our hope is that one day we will not imagine a health profession education program without an understanding of the role and importance of IPECP. Clearly, all of this underscores the importance of identifying, engaging, and communicating with a number of people at multiple levels within and or outside of the organization. Elise will continue with a more targeted focus on these activities.
Thank you, Jim. We're going to look a little bit more closely at communicating with leadership. It's absolutely critical to establish a clear and simply stated vision. We've all heard about having the team embrace a shared mental model, and that's what we're talking about. The other thing is we also need to provide solid evidence as to how IPECP will benefit the organization. In other words, we need to build the case for interprofessional education and collaborative practice. We also need to provide evidence about how it can benefit the organization at many levels. For instance, new interprofessional education requirements and accreditation standards for various health profession schools, achieving economies of scale in a time of scarce resources where we can pool resources, optimize efficiency, and achieve cost savings, and also have the benefits of collaborative efforts to develop innovative learning strategies. We also need to consider an organization's goals and mission. From an academic or a community-based side, we need to look at how IPE can advance the mission and goals, whatever the organization is. We also need to create that sense of urgency around the changes that are needed to support IPE. Healthcare system redesign certainly underscores interprofessional collaborative practice. We have the emergence of new systems of care that are directed at achieving what they call the value proposition, which is better care, improved quality and satisfaction for our patients and for our providers, and lower cost. We also need to understand the power in strengthening academic and community-based partnerships to provide students with experiential learning opportunities. We need to engage communities in problem solving, in interprofessional education, and enhance that engagement to achieve our mission of population health and promote better health of the populations we serve in the communities where we practice and where we live. The most important thing, of course, is improved communication, getting to know what the value is as working as a member of the team. Communicating with leadership also means taking advantage of opportunities to communicate about and promote IPE. So I always say, use stories to demonstrate why IPECP is important. Talk about maybe small pilot programs that you've had or feedback from families or patients or students who've engaged in interprofessional education opportunities. It's also important to identify those who are trying to detract from the value of IPE. Invite their criticism, invite their comments, because it only serves to strengthen the initiative because you can engage in problem solving. Again, align with strategic priorities that are important to your leaders. As I said earlier, you want to communicate regularly and you want to communicate often about IPE. As Jim had mentioned earlier, it's important to identify IPE champions. You may have heard of applying theory of change, and the theory of change initiative has an overall goal of aiding us in discovering champions or change agents that can help move us toward the ultimate end, in this case, IPECP initiatives. And, you know, the whole theory of change initiative grew out of evaluation and planning techniques, and it's a great tool for developing solutions to complex problems because it creates a framework for thinking. It sort of sets the stage for producing long-range results and helping us reach that shared vision that we talked about earlier. It also is a product of a series of critical thinking exercises. In other words, you sort of work backwards to the goal. What exactly do you want to do? You know, who exactly needs to help you achieve that? And it really helps you identify who's already engaged. There are lots of practical considerations that we can look at. We need to consider where we can find leaders, how we can identify potential leaders. Is someone already leading the charge toward IPE or collaborative practice? Or is someone a good person to engage in that role and maybe they've not yet taken a leadership role? Can we mentor them and guide them? Are there other opportunities or areas where leaders are needed? Are there influential leaders or people who are natural leaders or those who are trusted community leaders? You know, what type of leader do we need? Who is already engaged? Do we need a department chair who's a powerful department chair who can assume a leadership role? Or do we need a real community person, a real community organizer, to promote IPE in community-based settings? The other thing is, it always pays to back up a minute and look at other initiatives that are ongoing that might align well with IPE. Some experiences are a natural fit for interprofessional education and collaborative practice. Are there projects or courses where IPE is indeed that natural fit, or it can become a natural fit with just a bit of tweaking? Well, we had talked about communication and engaging leaders, and now we're going to talk about engaging stakeholders and partners. And this is the bread and butter of interprofessional education and collaborative practice. The first thing we have to do is define the difference between stakeholders, partners, collaborators, and end users. And stakeholders are generally persons, groups, or organizations with an interest in, or in this case, concern about IPE. The question is, do they have an impact on your organization's performance? Are these stakeholders ones that you can clearly identify and that you can identify what you want from them in terms of the project? Is there a dynamic relationship? In other words, are you interested in cultivating that relationship with a potential stakeholder so it can grow? Can you exist with or without that stakeholder? Is it easy to replace the stakeholder if things aren't working out? And the other thing is that sometimes we identify multiple stakeholders and we have just too many, and it helps to sort of take a moment to see whether or not you have a selection of stakeholders that are clustered in a particular interest area to promote interprofessional education or collaborative practice, because it's better to keep the group small. Partners are a little bit more formal. It usually involves a contract or an agreement of some sort, like a memorandum of understanding or memorandum of agreement that specifies what types of activities, processes, deliverables, and outcomes are expected. Collaborators, on the other hand, are sort of a superset of partners. And let me just say that all partners are collaborators, but not all collaborators will actually be partners. And then, of course, we have our end users, and depending on where you're doing IPECP, it could be faculty, it could be staff, it could be students, it could be patients in places where we're offering experiential collaborative practice. It could be the community at large or community members. So it's important, to consider who our end users are. Let's look at some characteristics of effective partnerships. Obviously, we want to have solid partnerships. We want to have strong partnerships that will give us access to additional financial and staff resources that may increase our service base in terms of the client services we can provide. They may have expertise that we don't have within our own organization. Effective partnerships also support skills and collaboration, the ability to negotiate and problem solve, resolve conflicts, and foster collaboration across multiple entities. Certainly interprofessional and facilitation skills help, but other things that we have to really consider are commitment and connections to the community and commitment within the partnership, to the partnership process and, the success of IPE. So when we talk about finding and selecting partners, there are just some things I think we need to consider. Good partners are people who are willing to participate in the process, who are committed to that shared mental model, that same goal and vision that we talked about earlier. They're someone that you can trust. They either have a history of engagement with your institution or your program or the community. They're people you can count on to get the job done. They have staff and volunteer capacity to participate. They're knowledgeable about the community or the program or your academic institutional setting. You have support and involvement from leaders at all levels. So your partners should not only be invested in the process, but the leaders of their organizations should be committed to the process as well. It is also important to strive for diversity as well as cultural competency. As our population becomes more diverse, we have to represent that in our collaborative practice and certainly amongst our stakeholders and partners. And the other thing is, we have to intentionally attend to our partnerships for IPECP and ensure ongoing engagement. And that comes through, communicating often, sharing information. One of the things I really want to focus on also is linking academia and community partners. As we attend to our partnerships and ensure ongoing engagement, we have to engage academia and our community partners in discussions. We have to create a regular forum for feedback and communication so we can monitor that as part of a quality improvement process. We have to build on existing or prior positive working relationships. We have to build on existing trust and reliability, but we also have to remain flexible and adaptive to change. Consideration of involving the lay public or perhaps some of the end users who are going to be impacted by IPECP is a good consideration also. And I had mentioned earlier about the idea of starting small, with maybe a pilot project or starting with a small number of partner organizations to make it easier to adopt and adhere to operating principles, and picking small projects to build upon success. People want to build on success and want to feel that what they're doing is really making a difference. So those are, some of the things that we should think about. I think we've put together a list of key references and resources they're certainly not all inclusive, but we think that they represent a broad spectrum of some of the materials, that we've talked about, some of the information we've shared with you thus far. Thank you very much.